Well, good afternoon. Friends, we're making incredible progress in our provincial vaccination plan. As of today, over 820,000 doses have been administered in Ontario, and more than 269,000 people are fully vaccinated. This is more than any other province in the entire country. And our vaccinations of Phase 1 priority populations is nearing completion, including the residents, staff, and essential caregivers in our long-term care and retirement homes, and adults in First Nations, Métis, and Inuit communities, including in northern remote and higher risk communities. This could not have been accomplished without the dedication and hard work of an army of frontline healthcare heroes. We're also grateful for them for the vital role they're playing in fighting this terrible, terrible virus. I said we'd be ready when the vaccinations arrived, and we are. Thanks to the incredible work of General Hillier and the Vaccination Distribution Task Force, we have a solid plan and are ready to get the needles into people's arms as soon as the doses arrive. Over 2 million more doses are expected to be here before the end of March, including 194,500 doses of the newly approved AstraZeneca vaccine. And the extension of 4 months between the first and second shot is a game changer in getting more people vaccinated quicker. We're also encouraged to hear today that J&J single-shot vaccine has now been approved for use in Canada, giving us a 4th vaccine in our arsenal. We're now looking ahead and gearing up for Phase 2, with a focus on vaccinating those who face the greatest risk from this virus: our seniors, individuals with specific health conditions, people living in congregate settings, and those who cannot work from home, such as first responders. This will help to prevent further COVID-19 deaths, hospitalizations, and transmission. And as the vaccine supply increases, we want to make it easier for people who want shots to get them. So we'll be mobilizing every member of Team Ontario. Vaccines will be administered in hospital clinics, primary care settings, mass vaccination sites, mobile clinics, and pharmacies across the province. We've also launched a pilot program for an online booking system and a call center to help make bookings at mass immunization clinics. The light at the end of the tunnel gets brighter, so let's keep working together to beat this. God bless the people of Ontario. Pass it over to the General.
Ladies and gentlemen, good afternoon, and thank you for giving us your time to hear about some of the things of the vaccination rollout program in Ontario. And I will say to you that in this last 3 to 5 days, we've had a seismic shift in our vaccination opportunities and the program to roll it out. So this afternoon, I'm going to take a few extra minutes, just walk through a little of the background review, where we are right now, where they are going in the program, and vaccine updates itself. Just a little review of the task force mandate, and with the Premier's announcement of the start of Phase 2 here, as he said just a minute ago, I just wanted to take a minute and review just how far we've come in 3 months. The Premier gave us until the end of March to advise, first of all, on the delivery and storage of vaccines, done. Provide clinical guidance on administering the vaccines, done. And of course, that is a living subject and still being done. Provide guidance on information and technology for vaccine administration, done. And encourage public engagement, encourage the public to want to take the vaccine. And from what we see in our polling, up to 90% of the people in Ontario eligible want to get the vaccine. Right now, the logistics and distribution plans have been developed and are in implementation. The clinical guidance has been well established and continues to evolve on the advice of medical experts in Ontario. And we have incredible medical experts to advise us here in Ontario. We have a steady flow of vaccines, and we have confidence that that flow will continue uninterrupted, or we are gaining confidence every day that that flow will continue uninterrupted for the vaccines arriving in Ontario. And not only will it continue uninterrupted, it will grow every single week. We have established integrated relationships with the critically important 34 public health units. And they, in conjunction with us and in collaboration with hospitals and pharmacies and primary care professionals and family doctors, will roll out the vaccination program across Ontario. Local officials have mass vaccination sites, mobile clinics, in-community clinics, all well in hand. And in fact, in the next several weeks, we will have 113 mass vaccination sites up and operating in the province of Ontario. Almost 1 million needles are in the arms of people of Ontario. And Premier, we know we have more needles in our arms than what you just said. And we are working right now to set ourselves up for success going forward when greatly increased numbers arrive. Over this weekend into early next week, we're doing a physical count, and we're going to confirm that count against the paper-based records that we had earlier on when COVAX wasn't always available. And our credo then was, as it is now, needles in arms first, so we'll do paper records. That was tens of thousands of them. We want to make sure we've recorded all the 6 doses that we got before it was officially a 6th dose. And we want to make sure that we also record when we get an 11th dose out of a Moderna vial and put it into somebody's arms. We're going to do that, but what we do know is by early next week, by Tuesday, we'll be at 1 million needles in the arms of people of Ontario. And by Monday night to Tuesday morning, we will have emptied the freezers across Ontario and be waiting for the next shipments, except in several small cases, which we know about, which we support, and which we are working to manage, and that's small numbers of vaccines itself. Yesterday, we vaccinated 36,000 people in the province of Ontario. Before lunch today, we vaccinated 15,000 more people, and we will continue to build that capability. This is compliments of the great work of the medical officers of health in each of those public health units, our hospital CEOs and teams, and now starting soon, the pharmacies and the family doctors and primary care professionals. Operation Remote Immunity has now visited all 31 isolated fly-in communities in the north, and half of them for the second time. The uptake in those communities has been enormous in all but 1 or 2 cases, and I compliment the leadership who prepared their communities, those who look to them for leadership. They prepared them well, and the people wanted the vaccine, and they've been able to get it. Vaccine priorities are continuing right now, concurrently. We're not doing things sequentially. We're doing it concurrently, and we're going to finish the long-term care and retirement homes, the patient-facing healthcare workers, the Indigenous adults in the prioritized at-risk communities, and those 80 and older across our province. Most public health units have been working on all of those priorities, most public health units across Ontario, and indeed have vaccinated significant numbers of people 80 years old and older. And I just remind you that in the long-term care homes and in the retirement homes, we have vaccinated close to 100,000 people over the age of 80. I just give you the example of the great public health unit at Wellington, Dufferin, and Guelph. And Dr. Nicola Mercer, who is an incredible leader, an awesome Canadian, with her leadership team, predicted and looked in the long term back early last summer, built an online booking system to have available for that health unit, built a call center, brought together the list of the population in her area of responsibility by age, and got ready to roll out for anything that they might be needed. They exercised that system during the flu vaccination program in the fall, and hence we're ready to go. As a consequence of that leadership and forward thinking, Dr. Mercer had registered more than 75% of the 80-year-olds and older and reached out to them in her area of responsibility, and as of yesterday had vaccinated 70% or more of those 80-year-olds. That's the kind of leadership that you see in spades across those public health units across Ontario, and we are indeed lucky to have them. And where we're going right now, well, as you know, there have been incredible developments this week with the handling, the storage, the dosage intervals, and increased supply to enable us to be in a transition to phase 2 literally as we speak. And not only that, but as we know, AstraZeneca and the Johnson Johnson vaccine approvals are game changers for us, and more vaccines are arriving all the time. And next week, we in Ontario, just with Pfizer and Moderna, will receive 325,000 vaccines to put in the arms of the people of Ontario. The public health units, the hospitals, the pharmacies, our primary care professionals, including those family doctors, are key to our success. And you'll be able to get your vaccine at the right time through your public health unit, through a mass vaccination site, through your family doctor or through a local pharmacy. The details on all of that will be coming out province-wide in the very near future. More mass vaccination clinics will open in the next weeks, particularly as the supply ramps up, and we're prepared to do it very quickly. And as I mentioned earlier, 113 clinics in the next several weeks, mass vaccination clinics in the next several weeks will open in Ontario. The priorities will continue to be based on age and high risk. We want to look after those who are truly in the most vulnerable of circumstances. Our customer service desk and the online booking system, probably the most awaited system in the world right now, is already in soft launch, running a pilot with 6 public health units. It will be ready for March 15th, but meanwhile, vaccinations continue. And as I said earlier, we've already vaccinated 15,000 before lunch today. The 34 public health units, working with their partners in the hospitals and the primary care professionals, are crucial to us being able to roll out that vaccination program. While we've had to wait for the online system for Ontario, our public health units have not stood around and not reserved people to get their vaccines. They've had systems in place, either call centers or online booking systems themselves, or both, or they've gone out directly and communicated with those people and brought them in and gave them the opportunity to get a vaccine when they had the vaccines there. And one of the things I would commend to you is that when you do get an appointment to go and get your vaccine shot, please do not show up 3 hours early. That's what we know, that people are eager to get it. We know that they're anxious to get it and make sure they don't miss their spot in line. But if you have an appointment, that means there's a vaccine reserved for you, and you will get it during that time frame. Show up 15 minutes early, please, because what happens is you end up standing outside, and then people see lines forming outside and get anxious about their appointment and show up even earlier, and that's obviously not what we want, particularly in this weather. The appointments are being made. AstraZeneca, obviously approved. This is a great vaccine. And I just quote to you the words of Dr. Robin Williams, who advises our team. And she said, you know, this reduces hospitalization and death in a huge way. And she said, it's a good vaccine. If we could get the flu vaccine to that level of efficiency, all the medical professionals would be doing cartwheels. They'd be so happy with it. It is a good vaccine. We're going to follow the best medical guidance that we have and start vaccinating those from age 60 to 64 next week in participating pharmacies. So those born in 1956 through to 1960. We will get 190,000, just over, that will arrive in Ontario on the 10th of March in just 5 short days. And up to 500 pharmacies in Kingston, Toronto, and Windsor-Essex will be part of the soft launch, along with our family doctors and primary care professionals, and we will roll it out through those channels. More details will follow in the coming days as to which pharmacies and where you would go and how you would go and book with their systems. But the planning is now complete and the final preparations are being put in place. Johnson & Johnson, it provides an incredible opportunity for us and is truly the icing on the cake in this vaccination rollout. 1 needle with high efficacy, 1 dose. So ideally suited, we believe, and we'll walk through this and get it right, ideally suited for folks who are hard to get to sometimes for a second dose, maybe such as the important farm workers, many of whom are migrant, who guarantee our food supply. And on the other hand, perhaps the homeless, who we can get to once but maybe not get back to a second time, and other places. It is easy to store and ship and is much anticipated to arrive in Ontario. We know it's approved, of course. We just don't know when our first arrivals will show. The needle interval. This really has helped us have a seismic change here and shift in this past week. The change in needle interval to up to 4 months is that seismic shift. And having 4 months or up to 4 months between needles means we can significantly increase the program and get a level of protection to the people of Ontario that we want to get much sooner in much greater numbers. The province will take full advantage of this opportunity to protect more people and to do it as fast as we possibly can. The aim now is to crush the numbers in the plan. And I know that Dr. Dirk Heyer this morning in the technical briefing talked about by the end of June, we should have enough vaccinations to get 1 needle in the arm of every person in Ontario who is eligible and wants the vaccine by the end of June. I want to actually challenge us even further, and I want to say by the first day of summer, we want to have vaccine supply dependent. We want to have a first needle in the arms of every person in Ontario who is eligible for the vaccine and who wants to get it. At the beginning of December, we didn't have a single vaccine to work with, and now we have 4. The task force worked to deliver the Premier's challenge to establish the foundation upon which we can build an equitable, ethical, and timely vaccination program. And we've done a variety of other things. The Minister of Health announced yesterday that the province now has a contract with the pharmacies who will play an essential role in getting those vaccines in arms. Agreements have also been reached with the Ontario Medical Association and doctors throughout the province so that they become a crucial channel to deliver those vaccines to their patients and more. And additionally, the private sector is ready to get engaged in rolling out the vaccine to their employees and families, and even to the people in the neighborhoods around them when their turn comes, or just as a mass vaccination center. And we know that Cargo Meats and Maple Leaf Meats and Sofina and companies like Magna and Onda have all offered up their establishments with their occupational medical staff who can vaccinate people to run mass vaccination clinics in addition to looking after their own employees when their term comes. And we will take all of them up on those offers. And ladies and gentlemen, in the province, as the province introduces phase 2, it does so with those things already laid in place and accomplished. Almost 1 million needles in the arms of the people of Ontario, and we'll get to that early next week. 250,000, just over, as the Premier said, have already been immunized with 2 doses, and yesterday 36,000 doses in the arm. We are on track to meet the challenge that the Premier has given us by the end of March, and I know that it's been a long year. I know it's been a frustrating winter. I know people eagerly anticipate the vaccine and are anxious for it to arrive. We need your patience just a little bit longer. The vaccines are arriving in increasingly large numbers. Our stand-up of the mass vaccination clinic continues as fast as the vaccines can arrive, and we will be ready to get a vaccine into you sooner than you ever imagined possible in this coming weeks and several months. I'd like to see us be able to wrap this up for the first needle in our arms with that incredible level of protection by the first day of summer. In the interim, please, let's not let COVID-19 re-emerge, re-engage and tie down our societies again. Practice the health measures, practice the social distancing, wear a mask, wash your hands, and stay separate from people that you should not be with. And let's get Ontario, with this bright light of the vaccine, back to a normal life. Let's get our families back to a normal life, and let's get the province of Ontario working again. Thank you.
We'll go to the phone line for questions. First question, please.
Your first question comes from Randy Rath with CHCH TV. Please go ahead.
Hey, Randy.
Hi, thanks for taking my question. I'm wondering how, if people between 60 and 64 choose to take the less efficacious AstraZeneca vaccine, and they don't live in an area where there will be a pilot project in the pharmacies, how do they go about getting that injection?
Randy, thank you for the question. This is for the first dose of AstraZeneca only in that pilot project, Randy. We've got 190,000 doses. That is a relatively small number for the slightly over 1 million in that group, 60 to 64. So the week after, when we get the next shipment of AstraZeneca, or a week following that, we will open up more pharmacies across Ontario to eventually have the pharmacy chain right around Ontario working. So it's only because of that first shipment of 190,000 that we're doing it in a smaller area with up to 500 pharmacies. We'll enlarge that greatly and use that pharmacy channel, which has immense capacity to get the vaccines to the people of Ontario very quickly.
Follow-up?
So it won't be available if you're not in one of those test zones next week. And also, once people are, everybody does have their first vaccine, and then we have to wait 4 months for a second dose. What do you think will happen with the color coding in the various public health units? Will they all go to green, or will they still be in lockdown? Like, what will life look like after people have their first vaccine shot?
I think Dr. Williams would be the best to answer that.
Yes, well, I think that's one area that we are wanting to look at. Key in there is, of course, as the general has alluded to, as we go through and vaccinate, as we see or anticipate that the case counts start to drop, as our numbers drop, then of course the framework would be impacted accordingly in there. Now, I think the question you're asking for, are there certain parameters within the framework that we might want to adjust depending on if the levels of vaccination? We'd have to get up to a high percentage of coverage. So we are going to be reviewing this matter, but right now we are anticipating that if we continue to vaccinate and we're going to see first impact on high-risk groups, seen a reduction in mortality and morbidity. But then the overall population numbers with case counts dropping, that could impact what level of the framework you're in. So we're not planning to change the numbers and metrics in there, but we are going to be eagerly anticipating the impact of vaccination writ large, and that will have a major impact on the overall use of the framework. And ideally, if you have everybody vaccinated, you may not need a framework. I know the Premier would be interested in that as well. So this is all things ahead. We look forward to that, but we got a lot of work ahead of us. We're not there yet. We're going to have to hold the line for now, especially with variants of concerns that are escalating. And so we're going to have to be really vigilant and diligent and following all the aspects that the General already alluded to with the personal protection. You got to do your part, no matter what frame you're in. Do it again, and do it consistently, and wait until your turn for the vaccination. It's coming.
Next question.
Your next question comes from Laura Stone with the Globe and Mail. Please go ahead.
Hi, Laura.
Hello. General, I wanted to just clarify something you said in your remarks regarding when you expect or hope all eligible adults will get their vaccine. Did you say you hope that happens at the beginning of July? You can just clarify that. And then also, the timeline presented here has moved up significantly. What you had previously said were the timelines for getting those over 60 vaccinated. Can you talk about what changed and what has sped that along?
Well, Laura, thank you for the question. What I want to do and be able to put as part of the plan, and we've been working towards it since we've heard that first that we're going to have AstraZeneca and then now Johnson and Johnson, but also a much increased flow of vaccines from across all four that have been approved up till now. And so that's all very recent, obviously, and what that has allowed us to do is do a lot of the planning, and we'll complete it in the next couple of days to actually crush those timelines really tightly. And our aim would be is to allow the province of Ontario to have a first needle in the arm of every eligible person who wants it by the first day of summer. That's kind of the challenge goal I put out there. The first day of summer, 20 June, coming up, obviously, and that's not very far away. So when I say, please be patient a little while longer, we will get to you, and we'll get to you much more quickly than we ever imagined before. And what's changed is what I just said. 4 vaccines now versus the 2 that we had, and arriving in hundreds and hundreds of thousands per week, and millions in April, May, and June. And we're ramping up the system as those increases come in to make sure we can handle them and put them into the arms of the people of Ontario. So we'll get fairly quickly into early April into 100,000 a day across the province, and go upwards from there as we need.
Next question.
Your next question comes from Colin DeMello with CTV News. Please go ahead.
Hi, Colin.
Hi there. Good afternoon. We learned during the technical briefing that people who have an appointment for a second dose could be forced to rebook as the province extends the timeline. That's obviously going to be a bit of a challenge for seniors. Is this fair to them that the province is not going to honor their existing appointment for second doses?
General or Solicitor General?
I'll be glad to take it, Premier. Thank you for the question. We are going to honor our commitment for the second dose for those vaccines that require a second dose. It's just that now, as you heard from Dr. Williams and Dr. Hoyer this morning about the interval being extended, that's what we are going to do starting on the 10th of March. So over the next several days, there will be groups of people who will get their second dose because it's too late to cancel them or not cancel, postpone their appointment out to further in the spring or early summer. But as of 10 March, that's what we will start doing. And that allows us to protect far more people with that huge level of protection. Look, I'm not a doctor. I'm an operator. I always have been. And here's what I understand in my terms as the way the vaccines work. The first one gives you an immense amount of protection. And the second one just adds a little bit, in most cases, to that protection, but acts as a booster to make it last longer. And so we know with those first needles, particularly in Pfizer and Moderna, but not just, that is an incredible level of protection, and allows us to perhaps mitigate a third wave, to protect people that otherwise would get COVID-19 or transmit it, and be able to do it so quickly as to be almost unbelievable, and that's what we want to do. So we will meet our commitment that the people of Ontario who take Pfizer, which is a 2-dose regime, AstraZeneca, 2-dose regime, and Moderna, that they will get their second needles. It'll just be an interval now up to 4 months.
Follow-up?
Thank you. I wanted to ask about vaccine wastage. Yesterday, we had learned that so far 1,500 doses have been wasted in the province, and the health minister says that the province has planned for wastage. I'm wondering what percentage of the overall stock are you anticipating could go to waste, and is that number at all acceptable?
First of all, any wastage we'd like to see disappear completely. But look, let's put this into context here. We're less than 0.2% of wastage. That averages out to about 19 doses a day when you're dealing with 35,000 doses that are wasted. So you say, oh, that's a terrible thing, and it is. We'd like to have every one of them. But I've been out to many vaccination sites, being with the pharmacists, the anesthetists who draw those vials, draw the doses out from the vial, working with the teams to how they do it. And every place we go, we talk about what is the wastage. And almost every time the answer is zero. And when there is wastage, because there is, as you saw yesterday, it comes in a variety of ways. Number one, when you put a needle into the rubber cap that seals those vials, occasionally the particles in that rubber cap are pushed into the vaccine itself, and you can see them there because those specialists look for that, and then they discard that vial. They're not going to put that into somebody's arm. Secondly, sometimes a vial shows up and it has a different coloration. They discard that vial because they're not going to put it into somebody's arms. Earlier on, there were vaccines, doses that were missed without question because we did not have the 1 cc syringes to be able to draw the doses, and sometimes you didn't get the 5 out of a bottle, and that was a wastage. But now with the equipment in place, that continues. So let me just say, it's not because of carelessness, it's not because of leaving it out of the fridge, not because not having it in the freezer, it's because of the characteristics of the vaccines itself. And all I would say is this. I've met so many people at those vaccination sites who are doing the vaccinations themselves. They are consumed by getting that 6th dose, by getting an 11th dose out of the Moderna vials, and consumed by making sure that not one single dose is lost unless there is no possible way to prevent that. You know, when we first arrived there, we heard there is wastage in vaccination programs. In the flu vaccine, for example, it's 5% or more. We thought, okay, if we can be less than 5%, that would be wonderful. At less than 0.2%, that is an incredible compliment to the medical professionals who are looking after the vaccine and are doing all the things that we in Ontario need them to do, and we should give them a vote of thanks for their incredible, incredible work.
Yeah, that's what stood out to me, General, when we went to look at these vaccination centers. Just imagine sitting there, how tedious it is with these syringes getting the exact amount. These folks are heroes. I don't know how they did it. Matter of fact, I don't know how they kept it down to 0.2%. Just, hour after hour, them putting these vaccines in the vials and into the syringes. But man, they're incredible. So thank you, everyone who's doing that. You're doing a great job, by the way.
Next question.
Your next question comes from Rob Ferguson with the Toronto Star. Please go ahead.
Hi, Rob.
Hi, I guess this one would be for the General. You outlined that the Johnson & Johnson vaccine would be more for people like migrant farm workers and people without homes. But I think we'll be getting a lot more Johnson & Johnson than to supply those two populations. So I'm wondering where else it might go, since it's so portable. Will it be for mobile clinics going to the hot zones? Could you just give us some other examples?
Rob, first of all, let me just tell you that we have not made a determination based on the medical advice, because where the vaccine was just approved, we'll need some time to have those medical experts to look at what's called the monograph and to get all the details for it. Everything we know says that Johnson & Johnson is an incredible vaccine, a high efficacy rate, and 1 needle. And so I was just really musing as part of our thought process and how we'll start to look at this, that when you have populations where it's sometimes hard to get to somebody for a 2nd dose, that might be good, and that's why I use the example perhaps of the farm workers. But it's an incredible vaccine, and we will use it across the population when we get more doses and when we get larger numbers of doses. So we will use it across the population, not just for groups where it is hard to get a second visit, because having that 1 needle vaccination program, that's a game changer almost in and of itself, and particularly if we get large numbers of the Johnson & Johnson in the spring here.
Follow-up?
Yes, thank you. And as a follow-up, you were saying the 2nd dose interval will be up to 4 months, as we all know. I'm wondering how that might change with with increasing supplies, do you think it will still take until, into the fall to get all those second doses done? Or do you think that, the supply situation might be such that they could be done earlier, perhaps by the end of September or something like that?
Well, everything depends on the supply. As early as we can get the supply, we'll get them into arms. And, we're just hearing as we come in here that potentially we'll have another 700,000 Pfizer in March, at the end of March itself, and then several millions more in April, May. And so that will help us pick up the speed of getting those first needles in arms, and therefore be able to start giving the second needles to people even earlier. So rather than waiting until all the first needles are done, as we get through the population, then, the over 80s who have not had the second needle, we'll be able to start with them earlier, and that means we'd be able to finish earlier. So I don't have a date time, but something, if the vaccines are there, the capacity in the province is there to put them into the arms almost as quickly as they arrive, and very shortly after, if not as soon as they arrive. So I'm optimistic that it's going to be much earlier than the fall to get those second needles finished. I don't want to put a time on it yet until we get a chance to look at what the supply is.
Last question.
Your final question comes from Miranda Anthistle with Global News. Please go ahead.
Hi, thanks for taking my questions. So yesterday we saw a number of seniors waiting in the cold to get vaccinated in Newmarket. In general, I know you commented briefly on this, but the seniors we've spoken to say they showed up 10 minutes early for their appointment, but they still had to wait hours in line. Some just left because their wife had an underlying condition and she was sick, so they had to go home. So my question is, how is this acceptable, and what are you going to be doing to fix this?
Thank you for that question. And there are people on the ground. I already talked to Tyler out at Newmarket this morning, and they are all over this. They don't want this to occur whatsoever, and that's why my comments about arrive 10 minutes early. A lot of people arrived 2.5 hours, 3 hours early. Then others arrived and saw them standing in line and got anxious and had it to that line. They were moving it through as quickly as possible. I would just commend to people, be there 10 to 15 minutes in front of your appointment. You'll get your vaccine at the appointed time or really close to it, so you don't have to wait 2 or 3 hours. There are all kinds of other measures being taken, though, as people showed up. I know in York yesterday, they had some buses moved up so people could actually go sit in a warm sort of area and still stay socially distanced, and looked after them that way. So all kinds of measures have been taken, and they've been taken by the leadership on the ground that I just talked about being so darn good, who are proactive. They don't want this to happen. They want to look after the people that they serve, and they want to get them the vaccine as efficiently as possible, and that's what they're doing. And when they have hiccups, they'll be better on the other side of the little bump in the road or the hiccup than they are on this side of it. Thank you.
Follow-up?
Thank you. And my last question is, we've been speaking to doctors who say they're not getting any guidance on distribution of the vaccine, and they're seeing hospitals that they work out getting inundated with people who just don't know where else to go. So my question to you is, what do you say to doctors who are critical of the rollout plan, and what kind of guidance and briefing are they getting right now?
I haven't been able to talk to every single doctor, so you're always going to find one or two or more who will want to criticize it. We have come to an agreement. We, the Ministry of Health, has come to an agreement with the Ontario Medical Association to ensure that the doctor's part in the vaccination rollout is covered by that agreement. They will be part of the AstraZeneca rollout starting literally next week, and will continue on from there. Whether they do it in their offices, whether they'll be part of a mini mass vaccination clinic with a group of doctors coming together to look after their patients and more, or whether they will continue to be part, as they have been up till now, of what somebody called a SWAT team going into residents where seniors are, or people with chronic care conditions. The primary care professionals, our family doctors, are part of the rollout here going forward. They will have more and more information over the next days and weeks as the vaccines roll in, and they will be a part of that rollout. We want that channel to take the vaccines out to the people of Ontario. We'll start with AstraZeneca specifically into their offices, but part of clinics and part of those mobile teams and part of SWAT teams also.
Just before we wrap up, I just want to thank everyone at the table, but I really want to thank the thousands and thousands of frontline healthcare workers. And you just see Ontario, and it's not about me, it's about all of them becoming a well-oiled machine, and the logistical undertaking is absolutely staggering. So as soon as the vaccines come in, we're getting them into people's arms. But again, I just want to thank each and every one of you. You're just absolutely amazing, and I'm very, very grateful. And for the people of Ontario, I'm feeling super positive. Yes, we have a long ways to go still. Yes, there's always bumps in the road, but I'm just feeling real positive with more vaccines and what I'm seeing out there on the ground, and people we're just getting better as we go. When I say we, all Ontarians. So folks, please stay patient. There is light at the end of the tunnel, and I'm feeling real positive this week and more positive every day as we move forward. So thank you. God bless each and every one of you. And before I forget, I want to wish my daughter, Kayla, that I never get to see, a very happy birthday. Unfortunately, I won't be able to see her today either, but I love you, honey. Thank you.
Thanks, everyone.